My name is Mark Scarborough. It is my honor and privilege to provide this tribute to outline to those who did not know Dr. Enneking why he is truly a pillar of orthopedics. Dr. Enneking had an enormous impact on me and my career. I first met him as a high school student. He gave me an opportunity to work in the cast room of the orthopedic department and later in his musculoskeletal pathology lab. Dr. Enneking was a gifted educator. His skilled use of the Socratic method when teaching was a memorable event for many of his students, whether they were pre-med, medical, resident, or a fellow. Students quickly learned that if they were late to a conference, they would be asked to sit in the front row of the room with the rest of the meeting to actively participate. Needless to say, few would be late twice. His dedication to education has inspired generations of orthopedic surgeons at the University of Florida and beyond. He was really meticulous in his educational methods. I was talking to two of his granddaughters recently, and they reminded me of their experiences with him at a summer sailing camp that he put on for the grandkids one summer. Prior to the week-long event, the kids were given reading material and a pretest. Each day they had didactic and practical sessions. And at the end of the week, there was a hands-on and a sailing test. The grandkids, now in their 30s and 40s, still talk about this today. So his knack for education in an organized and engaging fashion was special and memorable. So Dr. Enneking developed much of the cognitive framework for orthopedic oncology. He is most well known for the development of the staging system and the classification of surgical resection margins for orthopedic oncology. The paper describing this, published in 1980, remains today as the most often referenced publication in musculoskeletal oncology. But his influence went much further than this. He was instrumental in the science behind bone allograft biology, and he helped develop the practical aspects of bone banking that provides allografts for all orthopedic surgeons today. Dr. Enneking was a natural leader. He was chair of orthopedics at the University of Mississippi at age 30, and then he came to the University of Florida as the first orthopedic surgeon in chief in 1960. Here, he was chair for 20 years. He became president later of the AOA, the ORS, ISILS, and other organizations. And through these leadership positions, he had a huge impact on orthopedic research, education, and patient care. His greatest passions outside of orthopedics were fishing and family. He worked hard and he played hard. He was much more likely to accept a speaking engagement if fishing was included. Dr. Enneking helped form the bedrock of orthopedic oncology and is truly a pillar of orthopedics. I would like to thank all of the former colleagues of Dr. Enneking who donated to make this pillar possible. Without exception, everyone I contacted enthusiastically offered their support. So thank you so much.
Hi, I'm Mike Simon. I'm presently a professor at the University of Chicago, and my relationship in the AOA has been long-standing, basically about 40 years. I was an ABC traveling fellow in 1983, and I was president of the AOA in 2001-2002. I'm presently the historian of the AOA. I'm championing William Enneking as a pillar of the AOA because he was and is still an inspiration to me as an individual who represents a role model and passion concerning graduate medical education. I first met Enneking as a participant in his famous biannual radiology course of about 2 weeks, which is pretty long in itself. Because of this remarkable experience, I became his second fellow in 1975. Although Enneking is best known as an orthopedic oncologist, a founder of the Musculoskeletal Tumor Study, and a teacher of over 100 musculoskeletal oncology fellows, his impact on science, academic leadership, and graduate medical education is less well known. First of all, in science, he won the Kappa Delta Award twice, and he co-authored scientific articles over 7 decades. Pertaining to GME and leadership, Enneking was the chair of the Residency Review Committee of Orthopedic Surgery twice, He was the inaugural recipient of the AOA Distinguished Clinician Education Award. He was president of the AOA in the 1980s, and he was the president of the American Board of Orthopedic Surgery also in the 1980s. Enneking, along with Everts and Mencken, was pivotal in making or forcing our specialty to recognize the concept of continuing assessment of competence. I leave you with two quotes of Bill Enneking. The first is, the difference between training and education is a fundamental concept when one is dealing with issues of quality. And the second quote is, the concept of training is one of repetitive practice while the skill is mastered, while the educational experience embraces the observational outcome of applying rational, educational, and scientific concepts. In my opinion, there is no past or present pillar who exemplifies the AOA pillar more than Will Enneking. He was a master educator and a true quadruple threat.